Hi, this is Marcia with Craig Howard Insurance, and today I want to talk about the all-important topic of a big birthday that you might be looking at, turning 65. When you turn 65, everything changes when it comes to your health insurance, or it could. And you get lots of information around this time, lots of things in the mail, and it can be very confusing. So let me help clarify just some basics to know what type of changes you might have to look at and what possible actions you may need to take, or if you need to take no actions at all. When you turn 65, whether or not you need to take an action with Medicare really depends upon how you're receiving your health insurance today. So if you're receiving your health insurance through a group coverage from your employer, or if you're receiving group coverage through your spouse, you could also be receiving your health insurance through an individual plan through the Affordable Care Act, with or without a subsidy, or maybe you have no insurance. Depending on how you have your insurance makes a very big difference as to whether or not you need to take action. So first off, if you're receiving health insurance through an employer, whether it's yourself or a spouse who's still working, as long as you're still working or your spouse is still working, you actually generally don't have to take any action. For yourself, you are usually fine, stay on your group plan and just continue going forward, unless you're not happy with the health plan that your group offers you. Maybe you want to talk with an advisor about that. If you're getting your health insurance through your spouse, again, traditionally, you don't have to take any action, but definitely having a conversation with an advisor to compare costs is very much worth it, because in some cases, you might actually be paying more money for your coverage through your spouse than you would be if you had a Medicare plan. Now, if you have an individual plan though, especially if you have one with a tax credit to help you pay for the cost of insurance, you absolutely have to take action for Medicare. Your tax credit will not continue once you turn 65, so it is very imperative that you talk with an advisor so that you can choose a Medicare plan and make sure that you get signed up for your Medicare coverage. And if you have no insurance, congratulations, now is the best time to take care of that coverage. And you have no worries on that. We just need to make sure that we get you signed up for your Medicare plan. So the time to act. Your Medicare coverage will become available to you the first of the month of your birthday. So if your birthday is the 15th of a month, it will start the 1st. And the best time for you to make those choices to go along with your Medicare coverage for applying for your coverage and for applying for your Medicare plan is 3 months before, but you can literally do it 3 months before your birthday or 2 months. Technically, you even have up to 3 months after your birth month. That one's not always the easiest time to do it. There's some other consequences that might come with that, but it's best to do it before. And then it's an easy, smooth transition where you get to have your new health plan and your Medicare coverage happening. Now, of course, Medicare coverage and health insurance as a whole can be a very confusing topic, and that's why advisors are here. So fortunately, you don't have to do it by yourself. So remember, it's always free to work with an advisor. We simply answer your questions and point you in the right direction. So until next time, we'll see you then.